we're concerned. Okay, so good afternoon, and the situation and the aspects to deal with the situation is changing quickly. There's a lot of fluidity to the whole aspect, and that's part of what we call a quality approach. You have to deal with the issues as they change and move with those and be nimble to adjust and change in order to continue to contain aspects of the COVID impact upon Ontarians. And of course, some of the things we're working in concert with our peers across the country in Canada, and to be aware of those things. So there's a number of things we're going to be talking about today that deal with some changes, as I had noted in the morning teleconference or press session, that we're waiting to hear some aspects from the federal government and from the Chief Public Health Officer of Canada, as well as ongoing communications with fellow Chief Medical Officers in the country to ensure that we are consistently responding to this. So I think in light of that, first I'm going to ask Dr. Yaffe to talk about not so much detailing all the global numbers in that, but more what has been transpiring in Ontario that I think requires us to take some further actions around that as we deal with the changing situation and the number of challenges that we're facing with dealing with a response on this regard. So I'm going to ask Dr. Yaffe to talk about the Ontario numbers in the last basically 48 hours.
Okay, thank you very much, Dr. Williams. Basically, the numbers are going up very rapidly. It's a very quickly evolving situation now. We have found the numbers of new cases have almost doubled in a few days. And as of today, we have 172 active cases, 5 still resolved. And we're getting the number of new cases being reported each day is going up quite quickly. We had 32 new ones over the last 24 hours, and a significant number of those that have been investigated were exposed in the United States. Of course, as these reports come in, the local public health unit has to do the case and contact investigation, and as the numbers go up, it takes more time to get through all of those. So at this point, the good part is that we have looked at our Sentinel data, where we are testing people who are ill in hospital with respiratory infections, and a sample of those, and also outbreaks in long-term care facilities. And we've tested, I think, over 1,000, and they're all negative, which is good, very good, that we're not missing those cases. However, at this point, we really cannot definitively rule out community transmission. And so that is why at this point we feel that we need to take more measures, and I'll turn it back to Dr. Williams.
Yes, thank you. And so as we look at that, when we're talking about other tools, so far we're doing containment. There's always a question, and the Chief Public Health Officer kind of said in some parts of the country there is evidence of community spread. We continually try to search for that among our data cases. So far we're holding on our containment, but with the amount of inflow of people returning and the high levels or number of cases of positivity, we have to look at the aspects of how we might contain and control that so we can continue to do our containment type approach in that policy. Now, this is similar to what the WHO had talked about, that if you use social distancing and those measures alone, they work, but not as good as if you can combine containment and augment it by social distancing. So, in that we have continued with the work of public health at the local level. Cases coming in with a travel history or contact of a case were monitored, and they followed up with those, and people around there were monitored, and so you contained that impact in the community. And nevertheless, with the amount of cases and lab tests flowing through, there are some that do not seem to have a travel history or a contact case at this stage. But if you're going to undertake to investigate those ones, it takes a lot more work because you have to go out and identify not who they remember they contacted, but a wide circle of people they might have been in contact with and carry out that investigation. So that takes even further or more public health resources to investigate those, and it does take more time to assess that. At the same time, you can see that our resolves is saved at 5. As the lab system is loading up there, the amount of time you have to do to clear those ones is taking a bit longer, and we have to identify perhaps we don't need 2 negatives if they do 14 and 1 negative will be adequate. We're trying to address those questions to expedite that process. Besides that, since this morning and some further information that we received and we're working on, that we're taking a number of steps to increase the social distancing, the aspects in consistent with our partners and others at the federal level. We're talking about some additional closures. So we're going to be moving on. The new number is 50. So groups greater than 50, we're not asking those to be meeting. And they would cancel those or decrease them somehow to a smaller size in that aspect. And we'd like that to take place as soon as possible, knowing some will take a while. I'm not talking about weeks, I'm talking about a few days or whatever, to get that in place, because there are some stipulations and things you have to do, and we want to work with that. And I've had a lot of emails from different ones asking for some further steps we're going to talk about now. We're asking, this affects all recreational programs and libraries. That has been said by a number of communications in. All private schools, not just the publicly funded schools. All daycares in that item. All churches and other faith settings. And all bars and restaurants, with the exception of those restaurants that could continue to do takeout and delivery, because some people would still probably benefit if they're in isolation to have that provision and make that helpful. So we're asking those things to stay there. And there may be other things you may want to consider further, but right now, those are the things that we're really asking to take action on right away, because with the number of individuals coming back in the country, we're going to have to try and put those things in place to decrease the potential spread within our communities. So what does that mean for people? If you do not have any symptoms of COVID-19 and you haven't traveled, you're a citizen here, we're still asking you to your distancing, like we're trying to emulate here, and other people. Limit your daily activities, mostly around home. If you can, we're asking you to work from home in that, and only go out for necessary shopping and appointments. So this is for average citizens who did not travel, who have not been out of the case, and who do not have symptoms. And at the same time, you still monitor. And if you have some symptoms, you can look at the self-assessment tool that we've put out. And as we said this morning, that's been out, and within the evening it had 94,000 hits. So it's a valuable tool and tells you to step by step, if I have some symptoms, what do I do? And we don't want everybody going to assessment centers and to primary care on that right away, but do the self-assessment tool. And if you don't have symptoms, it gives you some advice and direction. If you do develop symptoms, it gives you advice and direction about telehealth, who to call, and other aspects there. So we'd like you to do that. If you think you've been exposed during that time to a person with COVID-19, we ask that you would self-monitor for another period of 14 days. That means watching for the signs and symptoms, which is cough, sore throat, shortness of breath, and temperature or fever in that idea there. And if you have that information and you do develop that, that's when you use the self-assessment tool, and then you go on to further connect with telehealth, and you could go to an assessment center or to a healthcare provider or public health for advice on that. And we're trying to ramp up all those resources, as we talked about this morning, to improve the response time with telehealth, bring a lot more staff on board with the self-assessment tool, assessment centers being opened up, trying to increase our laboratory testing capacity as quickly as we can on that aspect there, and looking at how we can improve the resources and capacity of public health to answer all those questions as well. So what if you traveled outside of Canada in the last 14 days? And you've heard the Prime Minister talk about some changes with the border, and we're looking at how to enhance that type of screening at the border, because some people said they've flown in or come in and no one asked them anything or didn't say anything. And so we've been looking for having that more thorough investigation at the border, which is a federal authority and responsibility, and we're hoping that some of the announcements would only but increase that and improve the staffing and equipment there. Because some people have come through and said I asked a couple questions and no one answered or didn't have the right documents and materials. So this is a ramping up. It takes time, and we want that to happen. If you travel outside, and this is travel anywhere outside of Canada, then you're going to be asked there's 2 levels. The one, if you're asymptomatic and you come back, we'd ask that you would, the term that you're saying, isolate, self-isolate in your home setting for 14 days. Definitely the key is self-monitoring. Limit your social activities and contacts in that basin. We're not saying you have to lock yourself in the room, but it's the same as like the regular citizens, but a bit more thorough, and looking at how you would do that, and limit your activities at your household and other aspects there, and use other services, internet services and that, and their assistance. And if you want to, you can do the self tool and get assessed, and then you can, if you develop symptoms and you want advice and direction, use the tool first, and then check where you should go or might get advice on how you follow the next steps to satisfy your assessment process. So we're also saying that for the 14 days, because it's everybody, that includes children and adults in there, that they resist use of some of the larger facilities, and we've already closed some of the recreational facilities and that. So that'll be limiting. So it's basically everybody being very sensitive. We're also saying, added to our other aspect, we've talked about throughout this whole process, who are we most concerned about? And what usually in the other countries that we've seen results in increased morbidity and mortality. And we've said it's basically the older population, those with comorbidities, and people who are immunocompromised. And so we're asking also that people who have been in that situation, who have come back, that they would also consider for the next 14 days limiting their activities outside the household, look at isolation in that sense there, monitor their symptoms, that's true, but try not to expose themselves outside to others, and really focus on that for the next 14 days especially, and we'll advise them further if that needs to continue. We're also looking at ideas around there. If workers have traveled outside and are coming back, what should they do? And we're trying to say that there's certain essential workers, such as healthcare, transportation, needs of necessary services and movements and that, and it's quite a long list that might fit that. And we're saying those ones there, because if there's a large group who have just come back and who can't go to work, that would compromise our healthcare response. It would compromise some other essential services. So we're laying out with the federal government that they would be allowed to go to work, but they would do a lot of, one first with the working with your employer, and they understand that. You're doing a lot of monitoring for symptoms during that time. There's a number of recommendations down there that what you would do, and including that, and if you develop any idea or any hints of symptoms, you would quickly choose to isolate, to get some assessments done, inform your employer, of course, and to wear a mask until such times you got a chance to be assessed and decide whether you should continue at work or stay home at that time. And so there's a lot of directions and detail and granularity in some of those things that we're going to be sending out in concert with our healthcare sector and with other key essential services, and they may be at the municipal level and different functions that you need to, we say, a continuity of operations and things to support our enhanced social distancing, and so that people in need of services could get those services and would not be compromised. So we're asking the employer, and you've heard announcements this morning by both the labor minister and by also the finance minister and the premier on the ways that we're trying to assist to make those type of things workable and feasible in any way possible for us to work together to deal with this aspect over the next, as I said in the previous conference meeting ones a week ago, the next 4 weeks or 6 weeks as we watch this issue. We're continuing to have the schools closed, that's true, and some other provinces have followed suit with that activity in there as we try to limit that at this time. So basically, we're enhancing our social distancing. We're using it as a tool to try and supplement our ongoing containment processes. We're trying to support in documents and material out to people who, whether they are never left the country and are asymptomatic, what should you do with Q's and A's on our web pages. We're asking people who have traveled and just come back with the 14-day period. What do I do in that time if I'm asymptomatic? What do I do if I am or become symptomatic? And then we have, of course, our ongoing one of people who get tested and proved to be positive. And then what I do if I'm quite ill and need to go to a healthcare setting. And that should be also expedited and worked on for those there. So we're trying to protect our healthcare system from being overloaded with people who don't need to go, but people have a need to know. And how do we make sure they get in the know and know what to do rather than being left in the dark in a sense. So we want to really enhance all those communications. At the same time, our assessment centers should be used for those that need assessment, and our lab testing for those that have symptoms, and to ensure that we have those that need to be assessed in that, and we have to continue to look at the quality of our testing system to make sure we're not overloading it, and so that those who need to be tested get tested in a timely fashion, and we don't have to wait for a long time to do that. So, so that's the travelers, the ones staying at home, essential workers. We covered that. We covered the closures in there. So this is this attempt right now over the next, this week especially, which is the first week of our March break, and the next 2 weeks after that. How do we handle that? Can we, I guess people use the term flatten the curve. I guess I'm saying more, can we continue to do our containment here in Ontario, as we have successfully, in one way, overcame our first 2 waves. One was the large concern with the outbreak in Wuhan and Hubei province, and then we had the following one with Iran, followed quickly by Italy, and then the European one, and now we have this one with the returning people from the USA, and how do we deal with that in that number, because we're dealing with much larger numbers, and we're asking that through this social distancing and these other steps taken here with a concerted effort for all Ontarians over the next week or two, because this is unprecedented. We haven't done this before, and there's a lot of things that will be done on the move. And the idea behind what we talked about this morning and this afternoon is what can we do to ensure that Ontarians, and Ontarians have been doing a great job on handling this, and I think we can rise to the occasion, do this over the next 2 weeks, and pull this under control. So that's what we're trying to work on now, and we'll take questions. Thank you.
Dr. Williams, so regarding bars and restaurants, you said these are now among the places you would like to see closed. Can you be a bit more clear what is happening in terms of closures? Should all bars and restaurants in Ontario now close?
We're recommending that they should, except those, they can maintain services for takeout and delivery.
And what has changed in the past 4 hours when you were asked about this and we were not at that stage yet?
As I said, the morning at 4 hours, waiting to hear what the federal government said and what the on the aspects there. So as I said, we'll wait to see what happens at 1 o'clock and then later, and then we had some further directions from the Chief Public Health Officer of Canada.
And then Dr. Yaffe, regarding community spread, you now said this can't be ruled out. Can you expand on that? Are we now seeing community spread or suspecting community spread is happening in Ontario? And can you expand on the fact that you say a number of the new cases have come from the United States?
Sure. Well, for example, in the last 24 hours, we had 32 new cases reported. I believe about 10 of them we still are waiting for details, but of the others, about half had traveled to the United States. So some of them were contacts of cases as well. Some traveled other places, but we know that there's a growing number of cases in the United States, and certainly we're seeing a growing and significant proportion of our cases have had exposures in the United States. So that is a concern, obviously. In terms of the community spread, what I'm saying is we cannot rule it out at this point. The investigation of each case is very time intensive, particularly when we're looking at perhaps they didn't have travel, the case didn't have a travel history, they haven't been around somebody who's been sick, so we're then going into the next level of investigation. And so there have been a small number of cases where the public health units are still doing the investigation, but they have not been able to find a clear link to a case. So we're saying, to be conservative, we're saying we cannot rule it out at this point.
Just to follow up on Laura's question about the contact tracing, when you're saying, these are taking a long time to figure out where exactly people have contracted the virus, at what point, what number of new cases would it become impossible to do these full investigations for every patient?
And that's our question we said all along, is that when do we move from containment to mitigation? And we're close in that area there. So if you haven't got the resources to do all that, as you can see, I said before, the one thing then we would tend to do is to ramp up on the protection of our vulnerable populations. And we've done that with the long-term care screening. We've done it with the retirement home, asked them to screen, and putting those, and we just keep, and we put in the 70-year-olds for the next period to almost like home isolation in a sense, but limit your social contacts and that kind of aspect there. And the other people are immunocompromised. And so then we have to look at the same time as we're holding on the containment, at a certain time, when do we say we're going to shift over or not shift over? So right now we have been containing, and as far as even the WHO has said, and I agree, it's better than just social distancing alone. If you can do both, all the better. So can we maintain that? And then what are the border issues that the Prime Minister announced? Is that going to impact yes or no, especially with the number of people are feeling obliged or obligated to come back from the USA, and we don't know the epidemiology or what's happening in the various states throughout the U.S. where all our people are down there would want to be coming back. How many have been exposed or not exposed? We have a significant number of cases being positive. And then if that happens, and you can imagine how many would be coming in a certain day, well over 200,000 to 300,000 people can be coming in. And so that means, how do you handle that? So we have to look at those practicalities in there and still protect our vulnerable and protect our healthcare system.
And there's been conversation today about whether or not cell phone data could be something that's used to contact trace. Is that something, in your opinion, that would be useful?
We know in one country they've done that. We're looking at all those options there. One of the things is Ontario, and like the country did that, is quite big. We have lots of large remote areas that don't have the coverage. So we would have to address the strengths of that and some of the limitations therein. But always ideas are being considered.
What can you tell us about the case where a CBSA officer has tested positive? And if this did happen at the airport, what kind of spread would that be considered? And should people be concerned at the airport?
Did you want to talk about that case or myself? Okay. So this was with the Peel Health Department is following up on this case. And as always, you want to look at that individual and in their work environment. Of course, there are lots of travelers. Was the person exposed or not exposed? Is there adequate protection, that kind of thing there? And then are there other employees who might have been involved in that period? So that investigation is ongoing at this time. So we haven't got that final report back from Peel, but it's all part of the case contact management in that regard to contain that. If there is any other cases addressed or any other cases that are attached to that person, then we'd have a cluster investigation.
Right, so if it's determined if that did happen at the airport, would that be considered community spread?
That would be called a cluster. That means like a workplace, like we've done before. Remember, there was a place where there was a workplace that was followed with employees, and there's one other case identified there. There was another one where there was an ESL class. So you deal with this as a potential site cluster, and if you can map that out, you can follow all those people that are in that and assess, did you get a spread or not a spread? And so that's not a community-wide, and that's the difficulty of the term community. And I think it's sometimes misunderstood that all these cases arise in the community, not all through hospital admissions. So they're all people that didn't go in the hospital. And a lot of them are seen on the assessment centers. So in a way, they're assessed and found to be positive in the community, and they're residing in the community. So obviously we don't mean that by community, because that's one term. If you're talking about a community case that doesn't seem to have any history of travel, any history of contact of a case, that means you say, well, they could have got it from the community. Do we know how they got it? That takes a lot more investigation. Now, if you find that there's someone in a setting and a group of people in a certain area and 3 or 4 others got it, and it didn't go beyond that, is it in the community or is it in a part of the community that you have walled off as a cluster investigated? That happens quite commonly, and Toronto and others have taken part in some of those investigations, much like you have with one of the homes in Toronto, and they're doing that as a cluster investigation there. If you have community-wide spread, that means there's a potential that you're saying it's gone from person to person to person, and it's out there. And then when you say it's community-wide spread, then your containment potentially it will no longer be able to hold that. So you have to see it's a spectrum. It moves across there. And so I think the term sometimes gets bandied around a little bit. You have to understand from public health management measures, it means different things in different settings. And so I was just saying cautious how to use the word community in the community or community spread. And we're always looking for, has it gone community-wide? And that's what the question we always ask ourselves. That's why we're doing the sentinel surveillance, saying, did we miss out on that? And are they there? So far, they're negative. Because if anything, if it's community spread, people probably should still get some symptoms. Probably still went to the hospital with, maybe they thought it was flu and got seen. And so we want to keep assessing and checking for that in that. So right now we haven't seen it. We're continually looking for it.
Is it fair to say that the Ontario cases to date have been fairly mild? And which conditions are the ones that actually create the possibility of you having a more severe case, COVID-19?
So I would say that the vast majority of the cases have not required hospitalization. I think currently we have 2 people hospitalized. So they're relatively mild. Obviously, they don't require acute care, which is very good. The people that are usually considered more high risk for complications generally are, as Dr. Williams said, older people, and they talk about 60 plus, they talk about 70 plus, depends on what you mean by older, but certainly over 70, and people with underlying health conditions, diabetes, heart or lung conditions, immunocompromised people. Those are the kinds of conditions that experience has shown us are more likely to have more serious infection.
When you're talking about groups of 50 or more, on public transportation, you get one streetcar that has 50 people on it. What are you saying about people that take Metrolinx or GO or TDC or even cabs? Because a lot of people going in and out of cabs, are they essential services, or how would you put that?
Yeah, well, cabs would be smaller, of course, and how they deal with those. But these are all good questions as we look at all the ramifications, how we would do this in a way that's effective and efficient that way without compromising overall care and services. I think when you're asking about streetcars and that, we have to look. We've already had discussion with Metrolinx. They've made some announcements already. The fact if you get on a streetcar and you stay on for 2 minutes and get off again, is that really a big issue? There's a lot of things to play in there because some people still have to use that to get to essential services and work. If they feel they have to do that, they may not have provision of a vehicle to get there. And so that we don't want to undermine that. Already you're seeing a drop in usage, a number of people involved in transportation right now. And so it's what we're going to have to address if it still is an issue, and how we might work with our counterparts with Metrolinx and others to say, how can we make this still safe and meet that criteria, and so the distancing, the 6 feet, can be maintained in that, while there could be like 10 or 20 people in a single car, but no one's within 6 feet of each other. Is that a big deal? And can you do that? Our people said it was so crowded we had no choice. Or do you wait for 2 or 3 to go by and wait for an empty one? So this is kind of decision making we're asking you to make, and you assess that situation. And so I don't have a carte blanche answer for that one there. I think we're going to have to wait and see how it goes and take advice of those involved in that area to give us further direction on how we might mitigate if there's any potential of not getting the distancing in that perspective.
Measures done to protect frontline workers, because we have heard multiple times that they are seeing a shortage of supplies and protective equipment and ventilators, and there are concerns about this. So our demand's not being met for them.
This has been, our command table is continually working at this issue here with how to get the proper amounts of equipment, whether it's gowns or masks or different aspects there, with a global shortage, of course. Right now we're maintaining that. We're not satisfied with that. We want to go and see if we can get more to make sure have that available when we need it. And so, we're asking our various sector workers to use the stewardship and conserve what you have in there, because if you're wearing some when you don't need it, then you've used it already. If you're wearing too much and you don't need it, but you want it when you really do need it, because we want to protect our healthcare workforce, so that when there's things that are definitely known or potential of airborne, they need to wear that kind of protection. And how do you facilitate that? Like even when you're bringing people through assessment centers, you can have, like we did during H1N1 SARS, you have a physical barrier, so the person doing the interviewing doesn't have to wear the protective stuff because you have the physical barrier, and you can put those things in place. So these are all things you can do to minimize the usage while we still go out looking to get more and we've been given approval to try and obtain those. And again, it's a supply issue that we work at daily, going after.
Why is this not mandatory?
Okay, let's, Fergie?
Okay, well,
Well, I mean, I've been.
she was first.
Yeah, go ahead.
Well, he's the vice president.
Well, your call.
No, you go ahead, and then I'll
Thanks
go.
for
But I got a
everyone.
couple here from people outside the building
Yeah,
that I
for
can
sure.
ask.
And then we'll go back to the top.
Yeah. So can you just explain why this isn't mandatory, or like, tell us what you would say to a restaurant owner who's going, oh, it's not mandatory, it's just a recommendation, I'm gonna stay open.
In my power and authority, I can recommend. I don't have that power to close places. You'd have to bring in higher levels of legislation and power and control to do that. And so thus far, a number of them have been asking for that, and public have been asking. So I think some of these, in my mind, sort of resonate with most of the public. And that's what we've been asking for, is they want to have that participation. So I would like to close, but I think my competition should do the same thing. So where's the even playing field? So we have the recommendation, that's fine. If we feel we have to go to much more power and authority, we'd have to go to a level above me to obtain that. Okay.
Dr. Williams,
Oh.
sorry, are you going to get in there, or you?
Yeah, with your other people.
Why don't we let Sean and then you can.
Go ahead, Sean, and then I got maybe
A
then I've
question
got
on
a
the
couple
testing
here.
centers specifically. I'm wondering if you can talk about the volume of people that are visiting them, and if you feel as if that is actually having an impact on relieving pressure on emergency rooms across the province.
Well, as they're opening up one after another, we're trying to assess that. We haven't, we've looked at some of our dashboard, and it's interesting that our ED visits have gone down at the moment. So that's encouraging. We're trying to ask that people, at first people are just going to an assessment center just because I want to know. And we're saying, if you don't have symptoms, don't go. And that's why we put out this self-assessment tool. And so we're making sure that doesn't get overloaded. And so I think from the early data we're seeing, that has reduced I think a good amount, the ED visits. So that's reassuring. So it gives us that greater flex. If the more severe cases have to be moved over, then we still keep them ready to go. And of course, there's the ongoing emergency health issues that are not taking a break. They still have to be handled. And so that's the case. And we're also looking at how do we ensure if we need beds and that, and looking at different steps and processes. This is all the command table, and we're making some progress on that as well to give us greater latitude in how we would deal with if there's a potential, all of a sudden, surge in cases. And as Dr. Yaffe said, right at the moment, throughout this process, we haven't had very many hospitalizations, fortunately. And we had the one death, unfortunately. And so we're still monitoring that closely. We can't rest on that. We have to plan and scenario design for if it was more complicated.
I just have a question about, can I just get one in about
Sure.
the pending cases? I know, can you explain why there's so many, and then if the source of transmission for those would be announced?
You know, I think the numbers are going up quickly, as I said. As we get the reports, and as the local health unit gets the report, they then have to contact the case and get all the information from the case, make sure, the case is isolated or hospitalized, as the case may be, and then interview the case in great detail about exactly where they've been in the last 14 days, who they've been with, and, sometimes the person doesn't remember, they have to be re-interviewed, and then go back and find out where have they been, who have they been with, exactly what were they doing. And then, of course, since they became symptomatic and 24 hours before that, where have they been and who have they been with in terms of who they might have exposed. So those are very detailed interviews that take quite a bit of time. And then they go back and interview who they've been with and so on. So, and of course, some health units have had a large number of cases, so they have to assign staff to do that, and that's why it takes time. But we absolutely update the data as we get it.
So if there is a confirmed community transmitted case, would that be revealed?
Yes, absolutely. But they go back and re-interview to make sure we haven't missed anything. And people, like, if you think about yourself, do you remember everything you did in the last 14 days and who you were with and what you were doing? And it might come back to you later. So we do go back and re-interview as well.
Okay, so I've got a few here that we put out the call for people who are self-isolating or whatever. and a lot of people are asking the same things. Since you're requesting daycares to close, what should be done about essential workers? Quebec is offering free daycare for all essential workers with kids up to age 13. So any recommendations on that?
I think it's a good question. That's why we had initially kept them open, or tried to, and knew it was by very much the local organizations, the private owners, as well as the boards of education who house a number of them in their public schools, to see if they could leave them open to assist in that regard. Because the time we have to go towards closing that, we've had a lot of concerns from the employees in those places that are worried about that, and so we've taken those steps. I think the aspects you've raised, if it becomes an issue and we become aware of it, we're looking at ideas. I mean, I would look at ideas and alternatives that would assist, especially to ensure that our essential staff can report to work and continue to serve our health system there. So it's going to be on a very much assessing and reviewing and coming up with ideas and directions on that. So
Would that be up to you to recommend, or would the government have to step in and step up?
it goes both ways. I could recommend, but sometimes that involves policy direction that would come from other ministers in either finance or labor and aspect there. But it's part of the overall approach.
All right. Another one from out there is Eileen DeVilla at her news conference, which is going on right now. She has confirmed community spread and said there's a number of cases they just can't, like to what Barbara Yaffe was saying, they just cannot trace. Like they don't think they're going to get to the bottom of it. So does that change anything here in terms of what non-essential businesses should be doing, for example? Should non-essential businesses still be staying open at this point? I know Apple's closing its stores and Nike is as well. What's your recommendation on that point?
We understand a number of the retailers have been proactive in doing that and have been consulting with the government in there. I think if there's some overall approach, I think that's something that would involve further discussion, because it deals not only with health issues, but it deals with economic impacts and other aspects and essential services and which ones should stay and not stay. So I think that discussion still has to continue to see if there would be an overall position from either recommendation from my side and with the government, if they had to take steps and directions how to do that, and to work in concert with our business and retail community. And of course in there's a lot of essential ones, which you can imagine, with groceries and different things. So there's a wide range of different ones you'd have to consider.
So, can we put a fine point on that? Like, should furniture stores be open and grocery stores be open, or should only grocery stores be open and non-essential businesses be closed? Given that it's community spread, I think the feds and the city of Toronto both said it's community spread now.
Right, we're trying to look at what are those essential ones, and ensuring that, and is there any aspects that impacts direct and indirect that would have that aspect. So because of the complex and the wide range, like the federal government was saying, and we agree, that people involved in transport, movement of supplies and materials, they should be exempt in there. Those ones that undertake that and supply the retail stores. So there's many components and parts to it that from an overall health standpoint, I'd say this is a good thing in general, but the granularity and how you deal with that would be a wider discussion within the government.
Given the fact that we're in the middle of this crisis, should we still have the discussions, or should we just say non-essential retail businesses should close?
If there is...
It's not, I don't think we have a lot of room for discussion given the growing rate.
Well, I think when the rapidity from today to this afternoon, and we're having some more discussions all the time with the minister, and then with cabinet and those things, we'll have to wait to see what decisions they make on that. So things have and are changing quickly. So I say stay tuned.
Just to follow up on one thing from people that are not here, a little extra guidance, please, on acknowledging you said gatherings over 50. So just to spread out what you said already about bars and restaurants. So we're talking movie theaters, we're talking stage plays, we're talking everything. Is that correct?
Yeah, that'd be in that category there, because they have gatherings of more than 50.
Or at any point could have more than 50 people, so would that recommendation stand for them as well?
We have to look at, see what that means. I mean, look at the big long lineups and that, and the ways they can spread that out. And some have already taken steps to do so in that aspect.
The retailer can't pinpoint whether they're going to have more than 50 people or not at their store at one time. Is your recommendation to them that you should close or stay open?
It's a good point, because their retail may be essential services that, like groceries and material, and that people need. So then,
Clothing store.
I think those are the kind of discussions we're going to have.
Dr. Yaffe, if you've traced the new cases, you say at least about half of them, from what you can judge, come from the U.S. What is your reaction to the fact that we are not closing the border to U.S. visitors at this point? I know the BC medical health officer has expressed concern about this. From either of you, is there any comment on whether there is concern about Americans still crossing the border into Canada?
Well, I mean, it's obviously something that is decided at the federal level. Yes, I am concerned, obviously, about people coming from the States right now, but I'm concerned about people coming from Italy. I'm concerned about people coming from lots of places. But yes, I am concerned about that as well.
And what if you could give advice to the federal government about it, what would you recommend?
We are on calls almost daily now with our counterparts at the federal level and the other provinces and territories, and this is obviously an item of discussion.
And is it now time for a coordinated national response across provinces to say, okay, this is what we're keeping open, this is what is an essential service? Are you now going to come up with some sort of standardized measure across the country about what should be open and what should not? Or is it going to be done on a case-by-case basis between provinces?
I think we're all moving in concert together. I think as of this morning, the discussion started about the 50 and very quickly moved across, and basically polling came to a consensus, that's it. The number of the closures and those aspects there started in one area, the discussion was continued. So in sense, what you're saying is what we're trying to do, because it's a federation, and while we don't pretend to tell each other what to do, we would like to, as much as possible, be in concert. And that's just something unique to a certain territory or something that it just doesn't make sense. And we would be able to explain why that is different, not trying to critical or judgmental in that sense there. So I think from the public's perception and with media and stuff, they're saying, well, if it's different, why is it different? Is there a reason why? And are you in agreement? So it continues to move like this, and that's part of the, I guess, the federated discussion along with our with the federal government in that regard.
Sorry to circle back to the community spread aspect. Go ahead.
I'll let you guys decide.
Can you clarify what your recommendations are for daycares? Are they all going to close, or just those that have more than 50, which I think is rare?
We're saying all.
All daycares should close.
Correct.
And just to circle back to the community spread aspect, and just wanted the clarification here. So now that we've heard from Dr. Davila from the city side saying that they know that this does exist, is your position then that you disagree and that you haven't seen it yet, or what's the clarification there?
Well, since I didn't hear the, obviously we're here, we didn't hear what was said. I think whether she's saying I'm not, because of the investigation and time and resources, we're not sure that, I can't be ensured that there isn't community spread. So there's a difference between not being sure that there isn't community spread and having direct evidence that there is community spread. And
saying that they know that there is community spread.
And that's what we need to ascertain, so that you can see that there's a person, but there's just all over the place, and there's people, and it seems to be spreading out. I don't know what that data is yet, because the cases we've seen, they've done a fantastic job, huge job, of following up on all these positive cases in their case contact management. So that's been a great credit to Toronto Public Health in that one, because I don't want to underestimate how much work that has and continues to be. And it's a matter of do we have to assess the workforce power and mandate, and can they need more assistance or not? Or is it that, in a way, has it gone beyond what they can cope with to manage and handle? As Dr. Yaffe said, that kind of further repeat many interviews and that to carry that out takes, as you can imagine, a fair amount of staff time. And is that capacity not there? And what do we do to address that? So I haven't had any, in fairness, in the meeting we're both doing press conference at the same time, discussions with Dr. DeVille to see what her perception, how that she feels that she can or can't keep doing on that process, and how do we go from here.
Who should get tested right now for COVID-19? I know the Public Health Agency has said there's a limit on kits available, trying to get more. So for clarity's sake, are you still, is it still people who have not traveled? Are you still trying to trace community spread? Who should actually be getting tested
And this is the last question.
COVID-19?
Well, we've been commenting out very strong that people who are asymptomatic should not be tested.
We've seen evidence of people having it who are asymptomatic. Idris
And we're
Elba,
saying-
I don't know if you've heard of him.
Stop doing that.
Really?
And we're saying that if you're not symptomatic, you should not be tested. The only ones who are going to test who are not symptomatic at the moment would be the ones we're trying to release from quarantine, right? And we're trying to say, do we go back from 2 tests to 1? Because our routine before was, right, 2 tests 24 hours apart. And maybe because of time of that, they've done their full 14 days or 14 plus, and they're now healthy and have recovered. Maybe 1 test would suffice. But that's a person who's being tested who's currently not symptomatic, but was a case in there. And we found that a lot of people were going and seeking testing because they just wanted to know, even though they weren't symptomatic in that. And so we're saying that if you're not symptomatic, you shouldn't be tested in that, because we've got to keep that. We may have to put some more limitations around that as our testing capacity gets overloaded in that, because we want to make sure there's a priority setting of what should be done. And we're having groups working on that right now to say, do we have to go to there, and such that it doesn't compromise our containment extensively. We can still monitor it, but some we do really have to test.
Who is the most
Well, the most part,
priority?
if you have people in the hospital who are quite sick, we need to know, is it a case, because that affects your practice in the hospital. You want to know, do they have COVID-19 or do they have tuberculosis or something else? Is it airborne? And that sets up all your PPE and your need for negative pressure or not need and all this kind of stuff there. There's people who are coming to the ED who are quite ill, and should they stay home or not stay home? Do they have this or do they have another condition? So it's part of what physicians need to do to rule in, rule out on cases that are concerning. And so you can see you start going down priority bases there, and then which ones would have greatest impact on community spread or areas that would be identified. So we're working very assertively on trying to say, if we have to, this is all the way looking ahead, if we have to curtail, which ones will we continue to test, so that if they need testing, they say, well, we're going to do testing, but it's busy, we're going to get an answer back in a week. Well, for a doctor in the hospital with an acute care patient, that's not good enough. And you want to turn that on rapidly. So we want to make sure the ones that have to be turned around get turned around, and the other ones we can deal with and handle that. But that carries through a whole education process, so that if there's a change, that the public understand, what does that mean? Does that compromise my situation, or can I work with that and get clear advice from public health or from the assessment center that if I don't need it, and I recover, is that fine? And then how do I know if I'm better and all that kind of stuff? So we have to put all that together so that the public aren't left confused. And we don't want to do that, because we need that ongoing participation. So we're working on that right now. We're trying to ramp up our capacity. Heading up, we're trying to head up, getting closer to 2,000, and we'd like to think in a week or so or more, getting up to 5,000 a day in that. So that's ramping up at this time.
Thanks, everyone.
Thank you. And remember, it's all in your hands. Hand washing and that, so it's in your control. Thank you.